I think this is a good place to start, seeing as everyone is settled now. Good morning, everyone, and thank you for being here today. My name is Shawnee Van Potren, and I'm the Advocacy Program Manager at Advocare. As I welcome you all today, I also have a few acknowledgements to make. First, I'd like to acknowledge the traditional owners of the lands we meet on today, the Whadjuk people of the Noongar Nation, and pay my respects to their elders past, present and emerging. I'd also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us today. I'd also like to acknowledge the Department of Health, Disability and Ageing, and in particular the Minister for Aged Care and Seniors in supporting today's event. And last but certainly not least, I'd like to acknowledge our colleagues at COTA Australia and COTA WA, who play a pivotal role in advocating for system changes to ensure what we have going forward is better and safer than before. The work they do, like all of us, is driven by the genuine interests of older people across our nation. OPAN and COTA are independent of government, and while they both acknowledge that these reforms are an important step forward, neither necessarily agree with every element that has been included in the new Aged Care Act or Support at Home program. Patricia Sparrow, lovely lady sitting there on the left, is the CEO of COTA Australia and was a member of the Aged Care Task Force. And both she and Craig Gear, who unfortunately can't be with us today, who is the CEO of OPAN, were members of the Aged Care Transition Task Force, both serving as members to ensure that oldest people's rights, dignity and safety were considered as priorities throughout the reform process. Today I'm here representing Advocare with my colleague David Thompson, who is our specialist advocate, financial advocate. As you can imagine, he's a very popular and very busy man with all the questions coming out of the reforms. Advocare is the WA member of OPAN, and amongst the many services we deliver is the National Aged Care Advocacy Program. This program is designed to empower older people, their families and carers through information, education and advocacy, including resources and tools to support self-advocacy. Whether you require assistance to navigate the system, information on your aged care rights, or support to resolve issues with an aged care provider, Advocare is your go-to organisation. And the best bit, all of our services are free, confidential and independent. Advocare is also the custodian of the WA Seniors Peak Body, established as a priority action in the current state seniors strategy. We provide a collective voice for older people and drive systemic change to foster safe and inclusive age-friendly communities. But enough said about all of us hosting the event today, because it isn't about us, it's about you. And the opportunity for you to understand the details of the new Aged Care Act and the reforms that are due to commence on the 1st of November this year. These changes in aged care are long overdue and aim to positively impact older people, their families and carers by creating a system grounded in dignity, respect and choice. We'll walk you through what's changing and why it matters. We'll ask you about your priorities and we'll try to find the answers to your questions if we can't answer them here today. So let's get started and explore what's ahead. We look forward to hearing about what matters most to you. I'll hand over to Pat.
Thanks, Shawnee. And thanks everyone for coming today. Hopefully over the next couple of hours we'll be able to give you information and answer some questions. And the reason we actually are holding the forums is because we have been concerned that the most important people are those who are receiving services or those who are thinking about services weren't getting the information that they needed, and that's why we're having these today. As Shawnee said, we support a number of the changes in the reforms, but we are independent organisations and we don't agree with everything. But what we want to do today is give you the information about what's changing. That's government policy, that government's made decisions about. We will try and tell you on the way through the things that we think will be beneficial and some of the things that we have concerns about and that we're still advocating about, so you know that as well. Sophia, I would like to introduce my colleague Sophia Petrov, who's the Manager of Policy and Engagement at COTA Australia.
Okay, thank you, Pat. And look, I think establishing an aged care system that really works for people. So establishing an aged care system that works for older people and their families is absolutely essential. And there's also the challenge of making sure that government's aspirations for the new aged care system are actually realised. So, and events like this are important for people to get accurate and up-to-date information, and for us to gather the questions, your concerns, and loop back and be able to advocate on some of those things back to government. So,
and we know that you'll talk to friends and family and people in your local community, so hopefully you'll be able to point them in the right direction to get the information they need.
Absolutely.
So we've got 2 hours now, which is quite a long time. Obviously there's tea and coffee at the back. There's morning tea if people need to get up and stretch their legs through the session. Please feel free to do that. We will take a short break halfway through at 11, but I am going to hand over to Pete. We're using a tool and technology this morning called Civility, and hello to everyone who's joining us online. We're going to take you through how this is working. There are people in the room who can assist you if you're finding it difficult. All you need to do is to put your hand up, and there's someone helping those of you online as well. So, Pete, do you want to explain how it works?
Hi everyone. So I'm your quiz master today. I'll be taking in your questions and asking you some questions as it goes as well. So does everyone know how a QR code works? Like, remember those from those times you had to do it to get into a shop? Now, we've gone around for those that were here a bit earlier and helped set them up. If you are one of the more than 50 people that are joining us online at the moment, so there's as many people online as there are in the room, again, this gives you a chance to feed in. If you've got problems with it, just use the chat and Alana or Tamara will help you out. But if you just hate using tech, I'm with you, it's totally fine. The reason we're doing this is we're running forums all around the country. This is, I think, Pat, the 5th one, number 6. So we're collecting hundreds of questions. And the one thing you can do to help us is actually put questions in, because then we can build up a big bank of the things that don't make sense to people. Whereas if it's just a few people putting their hands up, it's only a few voices that get heard. So that's why we're doing it this way. So if everyone feels that is working, if you pull out your phone now and just let me know you're in there, we'll have a little test. So does anyone need a bit longer to set up, or is everyone okay?
Don't forget, put your hand up if you're having trouble to get into the system.
We do have tech angels. I also noticed that we've got some younger people in the room that might be able to help as well. I bet you know how a QR code works up there.
You don't know how to set it up. Can we get someone to come and...
Yeah, Tamara will come over.
Great. Thanks, Tamara.
This is time well spent. So we'll just give it a sec. If it takes too long, I'm going to start singing, and that won't be good for anyone.
No, we don't want that.
All right, we'll give it a couple more, and then we're going to ask you a couple of questions before we get started. So basically it's about getting your camera, holding it over that code, and then you click the little yellow thing that comes up. It's like magic. Also, we're not tracking you. It doesn't mean that we're going to follow you for the next couple of months working out where you're going and what you're buying. All right.
once this is done, it's gone.
Hey?
After 2 hours today, it's gone.
Yeah, absolutely. Except the questions you put in.
Yeah.
But they won't be linked to anyone's name. Can you go to the next slide anyway, Tamara, just so for everyone else? Thank you. So start off, let's do a little test. What best describes you? And you just click whichever one. Someone who is currently accessing aged care support, e.g. a home care package, someone who expects to use it in the next few years, or someone who is supporting a family member or friend navigate the system. So that sort of comes through in real time. So we've got a good mix of people. Put your hand up as well if you're not using the phone. So who's currently accessing aged care support? Anyone? So you're going to have some really pointy questions, I'm sure, as we go. Who expects to be using it in the next few years? A few? Who's supporting a family member or friend navigate? Good on you all. That's outstanding. Which best describes you? Great. Yep. One thing we will be doing though, when you do want to say something from the floor, put your hand up. I'm going to run it out. Otherwise, the people that are listening online won't get a chance to ask it. Second question. Thank you for that feedback. Second question. At the start of this conversation, can we go there? At the start of this conversation, how well informed do you feel about the changes? If you sort of strongly disagree, it means you don't really know anything. If it's a number 5, you should be up here with Pat and Sophia. And also, how supportive are you of the changes based on what you know? And so we're going to ask you again at the end, after the 2 hours, on those 2 questions. And so at the moment, Pat, we're kind of middle range on, we're getting less.
We keep our jobs. Yeah. We keep our jobs.
We're going backwards.
And look, this is absolutely why we wanted to run sessions.
And we're kind of in the middle, although we've got a decent cohort of people that are just not really supportive of all. So that's quite interesting as well. So like I say, we'll come back to that. Now, that's all I'm going to ask you to do for the moment. But if you keep the phone open there, you can see, you might need to scroll down a bit, but there's a little Q&A. If you get a question as Pat or Sophie are talking and you want to log it, that will come straight through to my computer and then we can sort of replay it back. So thank you, everyone, and on with the show.
All right. Thank you. I think I get to do this. So I think it's important to have a bit of a context and understand where aged care has come from in Australia and the history of reform. So we started reform in aged care in the 50s under the Menzies government, and there was concern about older people ageing at home, and this was primarily about residential care and focused on mainly not-for-profit organisations accessing funds to build residential homes. And this is probably when COTA first got involved in aged care, and I can remember in our history, our first report was in the 60s around people living in residential care. So then we get on to the next major reforms in the Hawke government, and this is where we saw a shift from residential care to thinking people want to start living and ageing at home. And we had services being developed in partnership with the states and the federal government under the HAC program. So unfortunate name, Home and Community Care, HAC. And some of you may have heard of that, those services. And it was a whole lot of other organisations, mainly community sector organisations and local government, etc., getting involved. Major reform in 1997 under the Howard government, where we had a new Aged Care Act. This is the act that we're primarily still functioning under. And this is where you had the opening up of aged care to a lot of private providers, and there was a shift in terms of the way it was funded, and the Act was very much focused on providers, and Pat will talk a little bit more about that. And I think, Pat, that's probably when you first got involved in aged care or got interested in aged care.
It was actually the HAC program. So I saw a Four Corners program talking about HAC and thought I'd really like to be involved in supporting older people and aged care services. So I've been around for a while.
Yeah. So, and I think I'm just thinking back, I think I got involved when it was still the HAC program as well. So the next major reforms were in the Living Longer, Living Better under the Gillard government. That was an outcome of a report from the Productivity Commission, and there was a real shift in focus in saying, okay, people needed more control, and we had consumer-directed care, and this, I think we were very much involved as COTA in these reforms and pushing for consumers to have much more control over their packages, or over their services. So, and you saw this come out in where we had the advent of self-management, and I can see some familiar faces here, people who I've had contact with around self-management, and there was a much more focus on flexibility of funding, etc. So, and the last major reform, which brings us to this point, was we had a Royal Commission, and we've all heard about some of the terrible things that were happening in aged care. They all came out in a lot of those things in the Royal Commission, and the Royal Commission made about 148 recommendations. And one of the major things...
It was a lot.
Yeah, it was a lot of recommendations.
And there needed to be.
Yeah, and they had the report was titled Care, Dignity and Respect. And I think they wanted to have a big focus, a change of focus in the system. So I think, Pat, that's what's led us to this point.
And look, the number one recommendation from the Royal Aged Care Commission was a new Aged Care Act, and that the new Aged Care Act should be rights-based, and to shift the focus of the Act from being about government and providers to being about the people who are most important, the people who need support. So the focus now is much more on the provider and government and the support that they're providing to older people. So I think that's a good thing. And it was, I think the Royal Commission realised that if we didn't change the fundamental footing of the system to being rights-based, we possibly wouldn't get the changes that were really needed to the system. So that's really what the Act's about. You probably know that initially, and I don't know if any of you have looked at the Act. It's a bit sad that we know this fact. It's 1,400 pages long. There are rules that support it. There's a lot of detail in it, and we're going to be boiling it down as much as we can today to the things that we think are the most important, and based on what you think is the most important. So what we thought we'd do is we'd take you through what the changes are in a nutshell, and then we've got about 5 topics we thought we'd delve into. We want to check which ones you think are the most important, and obviously if there's other questions you should feel free to ask us. So the Act was passed on the 24th of November last year, the new Act, and originally it was going to be implemented from the 1st of July last year. It became clear as the date got closer that government and providers weren't really ready to implement the new Act. And we were concerned, when I say we, I'm using the royal we, as COTA and OPAN were concerned that actually older people didn't have the information that they needed. I don't know that you've still got all of the information that you need, but I think that some information is now coming out in the form of letter from Services Australia, and I should nominate, we've got Services Australia representative Kristen at the back of the room, and also colleagues from the department who are here as well if you want to have a chat with them in the break, and they've got some information for you there too. So you should be getting letters, or you may have got a letter, and I'll come back to those in a little bit, from Services Australia, that's designed to give you a bit more information. So that's why we supported the delay to the 1st of November. We didn't want people to not have their rights from the 1st of July, but we also didn't want there to be no information and for you to feel that you were having to make decisions without information. So this slide really just talks about aged care, and that the first thing that most people experience is trying to find care. People tell us how difficult that is, and Sophia's going to talk through that a little bit. And then what happens is when you've had an assessment, you end up being assessed for support at home or residential care, and go down those paths. Sometimes they'll assess you and say you could have either, but you'll choose which pathway you're going through. What's really important about today is that when we're talking about the rights, it doesn't matter whether you're getting support at home or in residential care, the rights are for both. When we talk about supported decision making, that's across both. It doesn't matter whether you're in home, getting support at home, or whether you're in a residential care. So those are the fundamental underpinnings of the system, no matter where it is that you're getting support. So the big changes, those big changes are quite structural and focused on rights. So the new Act actually does have a statement of rights. This is not something we've had in the past, and it's an important shift, and it's in line with what the Royal Commission wanted. Importantly, the Act means that providers have what's called a positive duty to uphold your rights. And the Quality and Safety Commission can be checking if they are upholding your rights, and if they're not, you can make complaints and get that looked at. One of the other really important key changes is supported decision making. And I think we all know, as older people, we've made decisions all of our life, some of them good, some of them bad, some of them in between. We wanted to make sure, and our colleagues at OPAN have been really strong on this, we wanted to make sure that that right wasn't taken away in aged care, which in the past I think we've seen assumptions made about whether people can make decisions or not. And we'll talk that through in more detail, but that's a really important underpinning. We've tried to advocate for stronger accountability and more transparency from providers so that you can see that. And also one of the things that both organisations strongly advocated that we did get through, because some of the things we advocated didn't, was that the complaints process should be independent. They've just announced the appointment of a new complaints commissioner whose name is Treasure Jennings, and she's come from the Victorian Mental Health services, which we actually think will be really important because they have quite good approaches to how they work with the people using services and how they respect their rights. So we think that's a good appointment. In the past, it's the Commissioner for the Quality and Safety Commission who's responsible for both. We thought there was a bit of a conflict of interest if you're the person who's there to accredit aged care services. Should you also be the person taking complaints and trying to sort them out? So this new complaints commissioner will have more independence, and we think that's important. There are changed financial contributions, and I know that's probably what you've seen mostly when you hear talked about it, and we will talk about what that looks like. The Act also has new eligibility requirements, so it's very clear now that aged care system is really for people who are over the age of 65, unless you're an Aboriginal or Torres Strait Islander person or a homeless person when you can actually access aged care services from the age of 50. We did have and still do have younger people living in aged care homes in particular. I don't think anyone thinks that's the ideal place for them to be, but we do want to make sure we don't want to see people going without support, but the Act tightens up that you need to be over 65. There is a new single assessment service, which is certainly having some problems keeping up with demand at the moment. We've got 121,000 people waiting for assessment, but the intent is that the single streamlined system will make it easier over time for people. You don't have to work out whether you have to go to the aged care assessment team or whether you're being assessed by the regional assessment services. You're just getting an assessment for all of the services that you could access. So hopefully we're working and raising issues about making sure that people can get assessed more quickly. The other thing, and Sophia will go through this in more detail later, is the quality standards that sit across home care and residential care have been strengthened. So for example, there are new standards around food, which is an area that a lot of people in residential care have been unhappy about, and there's a new hotline. So there's been some strengthening of those things as well, which is good. And really importantly, two last things to talk about is whistleblower protections. So for people who feel that they're seeing something that's not quite right, a family member, a staff member, if they're concerned about something, there are stronger protections that enable them to make a complaint or alert the authorities to something that's not quite right, and they'll have more protections and confidentiality, which hopefully will mean that people feel more comfortable to do that if they need to. And finally, a code of conduct for workers and providers, really important. You would have thought we'd have had that before, but this is a much stronger statement around that. So there's a lot of change to try and get through, and it does represent a fundamental shift in the way the service is designed. And we'll get into some of that in more details, but Sophia's just going to give you the nutshell of those two main pathways now, support at home and residential care.
Yeah, so the changes support two pathways. There's a pathway for home, for support at home, and a pathway in residential. So in support at home, we will see a change from 4 levels of care or 4 levels of support to 8 levels. So if you're on a package now and you're on a level 1, 2, 3 or 4, you'll translate into one of 8. Yeah.
I just want to ask a question. Does everybody know what a package is? Because we had this question at a forum recently. People weren't sure. Do people know what a package is? I can see mostly nods. And you also know that, no, some people not. So there are 2 forms of support now that you can get. One's called the Commonwealth Home Support Program, and that tends to be you might need one service that you're getting from a provider, which might be cleaning, or it might be Meals on Wheels, or it might be community transport, and that's called the Commonwealth Home Support Program. The other current program at the moment is the Home Care Package Program, and that means you've had an assessment and you probably need 3 or 4 things, and they package them and bundle them together and allocate an amount of money for you with a service provider to deliver. Maybe you're getting some meals, maybe you're getting some cleaning, maybe you're getting allied health, so it brings it together. And this new program, Support at Home, is really about, at this stage, it's about that package program and changes to that.
Thanks, Pat. That's a good clarification. So one of the things we're very excited about is that there's going to be a specialist restorative care pathway. That means, so you may be living independently at home, you have an incident, have a fall, you might break your hip, something else might happen. And what you need is some intensive support to get back on your feet. You probably don't need a whole lot of services longer term. You might need a smaller level of care, but it's an intensive package of different services, often allied health. So you might need some physio, some occupational therapy, some transport, some other things. So this is really great, and it's for a period of time to get you back on your feet, because we know, it's often you don't need services long term. You just need to be able to get home, live independently. So that's a really exciting thing. And there's also now a specialist pathway for end of life. So for those people who have been might have a terminal illness and need that extra support at home for probably the last 3 months of their lives, there's an extra amount of money to help them stay at home and be able to die at home.
Yeah, which is really important, because it's where most people want to die, but unfortunately more people end up going to hospital. So we're hoping that this will really help with that.
Absolutely. Another exciting thing is assistive technology and home modifications is a separate bucket of money. And there are some limitations on how much and every year that you can get, but it's separate to your package of service. This has been an issue in the current home care packages where people feel they have to save up for something, for rails or a ramp or something like that in their home. So it's assessed and it's separate to the package. And the thing that people are more worried about is the means testing in this. So will now be means testing for those people, which effectively means people who can afford to pay more will be paying more for their services. And in residential care, go on to the next slide. I guess we will have strengthened quality and standards of care, which we will talk about a bit more later. Means testing, which has been a feature in residential care, has changed a bit and will be strengthened. And the big that we're very excited about, and I'll talk a bit more about later, is that people going into residential care won't be forced to sign up for additional services. So there's a new regime around higher everyday living.
Higher everyday living services or
services.
fees. Yep.
Help. I think the acronym is HELP,
which sounds kind of weird.
It's weird.
Yeah.
So we'll talk a bit more about that a bit later on. So I think we're pausing there and seeing if we've got any questions.
Any questions?
Yeah.
Over to you.
The first one is, and I know a lot of you have been very diligently taking notes. Yes, we will be sharing these slides afterwards, so everyone that attends will be sent that, and it will also be available.
And sadly for people, you'll be able to watch it again if you weren't bored with us in the 2 hours.
Or zoom into Darwin or Gold Coast. Like there's still more. There are still some more great events. Just a couple of people are also having some technical troubles getting back from the questions to the slides. If you're at home, just click on the cross in the top of your screen, or send a note to Tamara. But there are some actual questions. Firstly, it seems to me that the welfare of older people with disability from before NDIS is not being considered within the home care system. All everyone seems to talk about is age-related issues. Is that a fair question?
Yeah, and I guess that's what the Act does. The Act is much more now saying the NDIS exists for younger people under 65 who've got a disability, and the aged care system's for people over 65. I think everybody kind of agrees ideally that's how it would sort of work, leaving aside some of the difficulties of people being able to get more support in NDIS and less support, and 65 being a bit of an arbitrary cut-off, really. But what did come through in the consultations before the Act was in was that we don't want to see people who are younger people not being able to get support, particularly in a rural area or a country town. It might be that aged care is the only support that they can actually get. So we have got some concerns about that, but the government's made a decision to make that distinction much stronger.
All right, I've got another one here. Will people currently receiving HAC equivalent services not on a home care package still be able to continue with those services?
Yes, so what's going to happen is the HAC, which became the Commonwealth Home Support Service. Don't you love all the acronyms and the names? But that's what happened. That program's going to continue as it is I think the correct wording is it won't move into this new arrangement before 2027. So you would continue, if you're currently getting a Commonwealth Home Support Service, that will continue. It doesn't change until potentially 2027.
Will Services Australia communicate with people on CHSP? I think that segues into something we're about to talk about in a moment anyway, isn't it?
But mostly the communication with Services Australia, I'm looking at Kristen at the back, is really going to be for people who are on home care packages and in residential care. She's nodding. So you probably won't necessarily hear at this point because your services will largely continue unchanged.
All right, we might leave it there and move on because a number of other questions preempt things that we know you're going to deal with soon. Is there anyone else that's got anything burning in the room at the moment? Otherwise, we're going to ask you another question. Oh, why not?
Okay, so my mum, oh, that's loud. My mum is on the CHSP and she really only needs domestic assistance and gardening to be able to stay in her own home, which is the intent of the program. So she has a garden that is way too much for her at the moment, but she can't get gardening services on the CHSP. She can only get them if she went onto a package because the provider that she's with, because there's a limit on the subcontractors that they have, they only give them to clients that are on packages.
Right.
They don't give the gardening services to CHSP clients.
And look, separately, we're advocating.
Who's buying the drinks?
We know that there are real access issues for the Commonwealth Support at Home program, and that people look for those services and often can't find them in some areas. And some areas, it's very patchy across the country. So in some areas you can get some services and then in other areas you can't. So all I can say at the moment is we continue to advocate for better coverage. We're continuing to advocate that there needs to be more of those services available. So I'm really sorry to hear that your mum's got that problem, but at this point in time, it's something we can take on notice. Maybe we can get some details from you after.
We better.
Yeah. So maybe between Advocare and COTA, we can talk to you in the break and see if there's anything more specific we can do.
I've just got a couple more that have come in on the end-of-life pathway, which I feel like it's worth doing now because I know we do deal with it. Will the specialist end-of-life pathway be an alternate to state-funded home-based palliative care programs or a complement to them? And a second question, will it be used by VAD clients?
So the intent is that it will be a complement to those services that are already provided. You should still be getting services. It's not an excuse for state palliative care services to step out of the system. I think voluntary assisted dying is a separate decision, and if people need those services that they're currently getting through packages and through a palliative care service, they should be able to get them.
All right, we might move to the more detailed discussion. Before we go there, we want to know what is the most important. You saw that graph before with the different elements: finding care, supported home, residential rights, supported decision making. Which of those is most important to you guys today? Just gives us a really good sense. So it becomes a little bit of a horse race. If you can pull out your phone and sort of put your preferences in, we'll get a sense of what matters to you. And we've been finding in most of the events around the country, it's kind of mixed, but it almost goes in the order. I don't want to preempt it because we're actually taking bets on this, Pat, but oh, you're not meant to do that, are you?
No.
Are they running?
No,
we're not doing bets on
No.
that. Here we go. So
They're
supported homes out the front, but then it will start moving as a few more people put in their preferences.
It would be fair to say support at home's probably been the one because there's the most change that's coming in on the 1st of November, and it's the one that more people are supported at home really than are supported in resi care. And it's the one the media is focused on.
We'll leave that up for a couple of minutes just to make sure everyone gets a chance to put it in. But yes, Perth likes to think, or WA likes to think they're different to the rest of the country, but really you're just the same apart from
Because we are,
GST
people said.
money.
Oh, very good.
Yeah.
Gardeners are almost impossible to find.
Yeah,
Privately or through paid.
yeah.
In Perth. Blame the mines.
And I would say that's quite consistent.
Yeah, no,
up in the
they're all on
mines.
fire.
And I would say that's quite consistent across the country too, that, those seem to be the areas people are having the most difficulty getting support.
And it
So
is
we'll
a
keep
broader
advocating.
question, but there is a broader question we've been getting in others that this is all great, but what about the availability of the workforce? And we know there's a massive waiting list
And I think that to cover that off, we continue to advocate for more packages, more Commonwealth Home Support services, support for the workforce, because we want people to be able to get the services they need when they need them. So rest assured that OPAN and COTA will continue to advocate for those things and do what we can to try and improve the situation there. But today we're sort of more focused on how we explain to you what's going to happen from the 1st of November.
One more comment up here.
Yeah, I just would like to bring your attention to finding care. I have been struggling since May, and I got so far, and then I hit a brick wall, and that was before July 1, and then it fell back down to an eased process, and that congestion is now been on my plate for the last 2 months.
So I'm really
And
sorry.
I'm mentally exhausted.
Well, let's
hitting brick walls.
let's talk in the break about whether we can give you any help. And it's not. I know it's not satisfactory. That's the first thing to say, and it shouldn't be as complicated as it is for people to get support. But that might be a good segue.
We've just
for Sophia
segued.
to
Thank you
just
very
take
much.
it through. But thank you for sharing your experience. And correct. And so we continue to argue that it should be made simpler. It should be easier for people. We need more resources to make sure that when you do put your hand up, you can get the support that you need. So we will continue to take those issues up.
Pat, before that jump, the other one that discussion from one of the other events was actually at what point should you reach out? Maybe that's the first step in what you go into now.
Yeah. Sophia, do you want to tackle that as you talk about finding?
Yeah, I'll talk a bit about that. So, I mean, the Aged Care Act imagines a system that's designed for people rather than for aged care providers. And that's the starting point that I can see some in the audience, but that's the starting point of the Act. That's what they want to see. And for example, you shouldn't have to tell your story more than once. It should be, right now we know it's way too complex. People are waiting for a long time. They don't understand where they need to start. It's not easy. I think when we did we were advocating at the time of the reforms, Living Longer, Living Better. We argued for one door, in terms of my aged care and my aged care,
and that actually my aged care would be a face-to-face service, which is not where it ended up.
And I think this is what we're still, that's still a dream, I think, but we...
So please be assured we'll continue to take up those issues.
Absolutely. And so, and in an environment of information scarcity, it's important for us to continue providing the information and for the information to be easily accessible to people. And I think, in terms of when should I start looking, I think the question for us, it's as soon as you think that that idea goes off in your head that you might need some support, something changes in your life, you should register on My Aged Care. It doesn't cost you anything. The registration and signing up for My Aged Care doesn't mean that you need services right now, but it gets the ball rolling. And we've had in other events people talking about how great it's been 12 months before they actually start accessing services, but they're registered, their details are there, and they're ready to go to have that initial conversation. So, I mean, in the new, under the new Act, My Aged Care is still your first contact point for the aged care system, and registering with them is your first step. You can register on the phone. You can register online. There are other pathways where you can have support to register. So I think GPs, some of them are still doing that. They're helping people to register for My Aged Care. And there are advocacy services like OPAN who will assist those people. And particularly there's the Care Finders program, which is funded through the Commonwealth Government right now, which supports people who may have other challenges, maybe language, maybe ability, those things, to actually register and navigate through the aged care system. So it's the first step. As Pat said before, the eligibility has become much clearer, and it's strictly 65 years and over, unless you're homeless or at risk of homelessness or a First Nations person. So we hope the single assessment system of not having to go, whether it's to an aged care assessment service or a regional assessment service, it's one assessment service that you'll be going to, and that's where you'll get your assessment once you've registered with My Aged Care and they've determined your eligibility for the services, or for aged care, not for the actual services, but to access aged care. Now, this is really important. There'll be an initial assessment call, and there's some terminology, they call it the triage call. So, where you'll get the call from the assessment service, and they will have a talk to you about what your needs are, what is happening right now, and it's really important to be open with them about your needs, because in that call, they will decide where you will be, what's your priority for somebody to come out and see you to actually do the assessment. Where some of the feedback we're getting on this is the calls are coming from no caller ID numbers, and people are often reluctant to answer that call.
I never answer from a number I don't know now, so it's something that we've started to take up.
Yeah, and we know that's some of the feedback we're getting. So I know our colleagues at OPAN are raising this. We're raising this with the department as well. But if you're waiting for a call and you know that it's coming, it's important to answer that call. There is also a time limit. They will call you a number of times before they give up, and that's something that we've been advocating for around, in terms of being more flexible around, or leaving a message or giving a number that people can call back on. So that's been a challenge in this space. So it's really important to answer that call to get a speedy assessment. So from there, you'll find out where you are in terms of a priority. You'll be booked for the initial assessment, and we know that in some areas there still are assessments that happen they happen on the phone, but the ideal is that it's face-to-face. The person actually comes out and they see you in action at home, and you have the people who support you, whether it's a carer, family members, advocates with you at the time. So be ready to answer the questions and be honest about what your needs are. And there are two outcomes. There could be the support at home pathway or the residential care pathway. Often they will assess, even for support at home, potentially for residential care if necessary. So I had a recent experience with my mum, who was eventually assessed for a level 4 package because she was very unwell, and they said, we'll assess you for respite care at the same time, so just in case. So it's often you might say, I don't want to go to residential care, but it's a good backup to be assessed. It saves time if you need that in the future. So, Pat, did you want to add anything there?
There's some great questions.
Questions.
Well, there's firstly a comment that reinforces the comment from the floor. The delay in packages is a disgrace. People's illnesses increase continually ahead of packages.
And we continually call that out.
Yeah. So thank you. So it is an overwhelming and difficult system for lay people to navigate, too bureaucratic, very few respite beds available for people. Will the new reforms improve these issues?
I think it's the base to improve them. What we've got to make sure government's doing is investing in the services. And if you watch the process, you'll know that the government, through a recent Senate inquiry, was forced to put more packages into the system. When we agreed to the delay of the Act, we were very clear that we didn't think there should be any delay in new packages being put in the system. Government actually chose to delay them. And then David Pocock and a Senate inquiry, the work of COTA, the work of OPAN, and to be fair, also aged care providers, we're all saying put those packages out. That's happening. We now have to make sure they continue to put the number of packages out that's needed so we don't have the bottleneck. So there'll be a number of packages released now before the end of next financial year, which should substantially reduce the number of people who are waiting, and we'll be keeping the pressure up to say at COTA we actually advocate. I don't know that I can tell you exactly the number of packages we need, but what we don't want is for anybody to actually have to wait for longer than 30 days. So once you're assessed, we think you shouldn't be waiting for longer than 30 days, and the 30 days is to give you time. The 30 days is to give you time to find your provider and get your services in place. So that's our advocacy position around that. So we can only agree with the comments that are coming through. It's not good enough. We're going to continue to advocate for that to be improved.
I think this is a statement, but I'm not sure if it's meant to be a question. The new Act does not cater for Alzheimer's patients who deteriorate at a faster rate. I guess to turn around, what have you seen in the 1,400 pages that addresses
so
this?
I mean, I think and I need to preface this, I'm reporting to you what the Act and what it says it's going to do. It does cover people with dementia. I think there is concern from people and advocates like Dementia Australia about how well that's catered for. So the intent is that it's for all older people, but there is concern about how well it does that.
Sorry. Jeff's like the trainer running onto the field at the moment.
And look, the new Act hasn't started. There are system issues now. There will continue to be. It's not going to be perfect. I think on the 1st of November we're not going to wake up and find that everything's different, but we will continue to advocate for the needs of people with dementia, and we work with organisations like Dementia Australia as well.
One more question that's come in from our remote audience. If you register for My Aged Care but don't necessarily need services straight away, when they call you to triage and realise you don't need services, will you still remain registered with My Aged Care?
Yeah, I'd say once you've registered with My Aged Care, you stay on My Aged Care, and so your details will be there. So you can reactivate that at any time and give them a call and say, I really need the services now. Yeah.
All right. One hand up. We probably need the mic so the people at home can hear you as well. Sorry.
I was just going to say it's a good idea, even if you don't need it, to register. We've done that. And then when things occur later on, you can get access far easier.
And I think sadly, because of the situation where people are waiting too long, you really don't want to leave it for a long time. When you start to feel, I think it's great that you've done that. When you start to feel you might need services, register.
Sorry, about the assessment, you said somebody will come and assess. My friend is waiting. She's going through cancer for 9 months now, and ECNA hasn't been able to come and assess her. I phone for her every 45 minutes to 1 hour. I wait, and this is since December I'm waiting, and still no assessment. So
Yeah,
that's
look,
what I like. What's the point of having the packages if they are not assessed in time?
And I'm going to agree with what you're saying. We're arguing and advocating really hard that the assessment happens more quickly and that there are more packages. So, and I don't know, potentially we could talk to you in a break to see if there's anything we can do to assist. But all I can say is this is not about telling you today that the number of packages is right or that the number of assessments is right, but we are continuing to advocate for greater investment so that people aren't in this situation, and we all agree that it's a disgrace.
Comment, if I may, is that the publicity put out by the government in terms of the waiting packages does not match the letter that comes in from Centrelink. From Aged Care. For example, level 3 package. A level 3 package. The letter from Aged Care is 9 months. The government doesn't say 9 months. It says a much shorter time than that.
Yeah, and look, we know people are waiting for longer than a year, and that's something we can take forward about making sure that the information's accurate. So I think we've got a question down the back.
Hi, Miss Barrow. I'm Patricia. Just very confused because I belong to the grandfather account. That means, okay. I have about a balance about 3,000.
We are going to
talk about grandparents
that next in a little bit more detail. Is that okay?
Okay, what about the appliances list? Has it been confirmed?
The appliances list, do you mean?
Assistive technology.
Yes, assistive technology.
Has the list been confirmed?
I think the list is available now. Yes.
So my provider should be able
I believe they should. We can double check that for you, but I believe the list is out about the services that are available and the appliances that are available.
Thank you.
Thank you.
Sorry, I just have a quick comment on the role of Centrelink in the package allocation. So my dad had prostate cancer and he was assessed for a package. He was luckily allocated one pretty quickly as we advocated for that. We were then told to wait for the letter from Centrelink about the income, and we rang Centrelink and they told us we were going to be getting a letter in paper form through the post system, which was incorrect. It was always going to come through the MyGov account, which my dad by that stage wasn't even really aware that he even had the MyGov account. Long story short, there was a massive delay. He got the package. Once we realised, we kept ringing Centrelink, we kept getting told the same wrong story, and he got the package and he died a month later. So I'm just wondering if there is any processes or training or whatever can happen with Centrelink to get them on board, because they are absolutely useless.
Look, I think we continue to advocate for letters in writing, and I think our colleague would tell you that there are letters going out now that are physical letters that are going to people. I don't know, Kristen, I don't want to put you on the spot, but I know that Centrelink's been working really hard to try and make sure, or Services Australia, I should say, has been working really hard to try and make sure that the amount of time before people hear is coming in. Did you want to make any comment on that, since as you're in the room?
Sorry, I just missed the last bit when I was waiting for the mic.
Did you want to make any comment about the issues about hard copy letters and what the processes are?
Look, yeah, I do apologise that you did have to wait so long for the letter. I can confirm that Services Australia is actually officially up to date with the processing of the means assessments now, in preparation from the reform going from the 1st of November. So there shouldn't be any delays going forward with getting the letters sorted. In terms of the letters coming out in the post, unfortunately, it's in our system. It's not something that we can rectify it prior to the assessment being done. We can elect for the person's letters to come via post rather than MyGov. But unfortunately, if you're actually registered to MyGov, it does link in our system for letters to go internally in the MyGov system. Oh, okay. Yeah.
So we can pass that back, can't we, Kristen?
Yeah, for sure.
Yeah.
Thank you so much.
This is just a comment for the audience, I suppose, to hear, and that is that phone call, when it happens, is a critical phone call. You need to be prepared. Spend time, a lot of time actually, a few days, like an exam, putting down everything that's important for you and everything you think you are going to need insofar as help. And talk to friends, talk to relatives, talk to your kids. Try to get a really good understanding of your situation, because the problem is when someone asks you, how are you going? Your standard answer is, I'm fine. And you're not.
We're used to doing that.
Yeah, we all are used to doing that, that's for sure.
I'm going to say just one comment, that first phone call will probably be about 20 to 30 minutes, so it's a substantial call. Yeah.
So I'm going to just talk now about support at home, and I think this is the one that people are seeing the most that's being written about. So as Sophia said, we're going to go from 4 levels of package to 8 levels of package, and we'll have the 3 service pathways. And some of you are already receiving support at home. For those of you who are already on a home care package, you'll transition across. There'll be some technical things that government will do behind the scenes, but you will transition across to a new package level. But you'll continue to pay the same amount of fees as you're paying now. So the government's talked about what they've called the no worse off principle. Just to explain that, the no worse off principle applies to the amount of fees that you are paying. Because aged care providers are setting their own fees, which is not something that we were thrilled about. We wanted the Independent Pricing Commission to set fees. Your provider's going to come out to you with a new sort of price list. What you pay won't change, but the amount of services that you receive might change depending on what their prices actually are. So this is the trick to watch for. No worse off relates to what you're going to be asked to pay. It doesn't necessarily relate to the amount of services that you're going to get, and I'm happy to talk more about that. But to the question of, if you are currently in a package and you have unspent funds, those funds will transfer with you, and there's no limit on the amount of time for you to spend those funds. So you can spend them as you need to, whether that's in a hurry or whether it takes you longer to spend it. That money will go with you and you don't lose it. So that's really important. And I might talk more about no worse off. We might just bring up.
That money would transfer over when the new plans come into place. However, the new plans, you'll only be able to carry over 10% each month.
But unspent funds will be different from that, so you'll be able to keep your unspent funds.
So it's probably worth clarifying that with the audience, I think.
I'm going to talk about that.
Thanks.
So, but what's clear, what I want to leave people with is the unspent funds go with you, and you keep them and you spend them, and there's no time limit on the amount of time to spend those funds. So for existing people, that's basically what will happen, and happy to talk more if we need to about the fact that the way that providers are setting their fees may mean that you will get less services. If you're in the position where you might end up that the provider has a conversation with you, their fees are going up and it means that you're going to get less services, there are some things you can do. The Quality and Safety Commission has to monitor whether the fees and charges that providers are charging are reasonable. So if you're concerned that you think the prices are way out of control, you can actually go to the Quality and Safety Commission and ask for that to be looked at to determine whether the fees are reasonable or not. You can also ask to be reassessed. Because if you find that you need more services than what you're now able to get, you can go back through a reassessment process. Now, I know we've just talked about the problems with that. I'm not denying that those problems exist, and as I said, we're going to keep advocating for those things to be better, but you can seek a reassessment. And finally, you can also look to change providers if you want to, and you cannot be charged an exit or an entry fee. So if a provider says to you, if you're going to leave, we're going to charge you a fee, they cannot do that under the new Act. So those three things you can do if you want to make sure that you're getting the best deal you can possibly get. Just on the issue that the person raised earlier, we should probably, I think the next slide will bring up the budget details, if we can move to that one. So this is absolutely true that the budgets are quarterly and will align to the package levels, and there's a more limited amount of money that can be carried from one quarter to the other. Under unspent funds, it all built up. So the budgets are quarterly and they align to the package level. So from the base package, it's about 2.75 per quarter, up to 19,500 per quarter if you're on a package level 8. 10% of your budget overall will be allocated for care management. So this is if you're new into the system from the 1st of November, 10% of your budget's going to be allocated for care management, and it can't be used for other services. You should expect, if you're in this place and you've got a package and you've got money for care management, that providers should be in touch with you on a regular basis, generally around once a month, to see how things are travelling and make sure that things are working for you. The prices that you will see for services are all inclusive. So what you will have seen potentially in the past is, providers were charging a certain amount for administration, et cetera, What you'll have now is a cost for an hour of home care, and that will include management, travel and third-party costs. And there'll be 3 streams of care that you'll see, individual services within, but 3 streams of care being clinical care, independence and everyday living, and I'm going to talk more about those in a minute, but that's basically how the budget will work from the 1st of November.
Pat, I think one of the positive things in terms of the levels of care is that the highest level package will be about 76,000.
78.
Yeah, 78,000. So it's
higher than what?
It's higher than what's currently in the
Absolutely.
system. So that's
Which
really
is good.
positive.
So that's kind of the budget details. But so if we go into now, which I know a number of people do want to have a look at, it is about the fees and charges. So let's talk about that. There's a couple of things to note here. One is, as I said, there are 3 streams of service types now. Clinical care is things like nursing and allied health and nutrition. Government has made the decision that it will pay those costs for all people, and there'll be no co-contribution that you need to make, which is a good thing. Independent services includes things like personal care and social support, respite care, transport, a range of things, and there will be a co-contribution for those services. And then finally, you have everyday living services, which is things like gardening and home maintenance, domestic assistance, and again, there's a co-contribution for that. Now, there are sort of 4 main steps in the way that the services will be means tested and assessed. It's clear and easy to understand if you're a full pensioner, because that's a set amount. So if you're a full pensioner, as with everybody, you'll pay absolutely nothing for clinical care. You'll be asked to pay 5% for anything that's delivered to you under the independence category, and 17.5% for anything that's delivered under everyday living. Now, I should say that we've been very concerned about personal care, and particularly showering is classified in the independence category. We don't think that's right. I don't think any of you are asking someone to come in and give you a hand with a shower because you feel like it might be fun or helpful to have someone do that. You're asking someone to come in because you're at risk of falling, or you've got a health condition that means that you need that support. So we are advocating strongly to government that at the very least, showering should be seen as a clinical care service. Sorry, Sophie.
Just a question. The contribution is the 5%, the 17.5% is of the provider's price. Yeah.
Is of the provider's price. And this is why we actually wanted the Independent Pricing Commission to set the caps. But the best that we could get at the moment is that the Quality and Safety Commission will look at the reasonableness of the fee, and yes, the percentage is against the price that the provider's charging you. Now, there's two other steps, and that's for people who are part pensioners and also people who are eligible for the Commonwealth Seniors Healthcare Card. This is where you'll see in independence, as I said, clinical care, there is no cost to you for that. But for independents, people might be paying between 5 and 50%, and this is where the Services Australia assessment is really important, because they'll take into account your personal information about your income and assets, and they will determine and send you a letter about where you are on that. Are you paying 5% of the price cost or 50%? So the letters that are going out now, and some of you may have already received them, I know one lady already has, will tell you that you're in that category where it's 5 to 50%, and you will get more communication after the 1st of November that tells you exactly where you are in that. But we were keen that there be some letter that comes out that gives you some clarity about the group that you sit in. And then finally, for people who are fully self-funded retirees, again, there's no co-contribution required for clinical care. But it will be 50% for those independent services and 80% for everyday living. It's important to note that there is a lifetime cap on these means-tested care fees. So from the time you come into the system and getting home support to the time that you exit the system, whether you've just stayed in home support or whether you've ended up in residential care, you won't pay more over your lifetime than $130,000. So that's how the fees and charges will work. The letters are going out, as I understand now. Some people will have already received them, some haven't yet, which will tell you which category you fall into if you're a full pensioner and you're paying 5%, or you're falling into one of these other categories. And then from the 1st of November, you'll get another letter, particularly if you're in those part pensioner and seniors healthcare card eligible, that will say, it could be between 5 and 50%, but the letter after the 1st of November will say it'll be 20% or whatever it actually is. So I know that people feel strongly about different elements of this, and we can debate that, but this is what will come in from the 1st of November. What we will be doing is trying to monitor really carefully what's happening. Our main concern is that we want services to stay affordable for people. We have to monitor and see what the impact of this is, and we'll be taking those things up. And we would really ask to hear from you as you go through this process about, can you get the services you need? Are they affordable? You can also apply for assistance. So if you can't afford the fees, again, it's through Services Australia, you can apply for what's called hardship assistance. But it really just means if you really can't afford the fees and don't not take services, go through a process and try and get assistance, because you can have your fees waived or reduced. if you apply for assistance and are eligible to get that, and that happens through Services Australia. We will continue to monitor. Our overall concern is that it should be affordable for people. You should be able to get the services you need, and there should be a strong safety net if you can't afford to pay to get that. I think we've touched on the pricing, but just to reiterate, at the moment, the providers are setting their pricing. It has to be reasonable. The Quality and Safety Commission will monitor that, and you can make a complaint if you don't think it is. You can change providers. You can apply for financial hardship. Next year, the Australian Government's Independent Pricing Authority will be recommending a cap, and that will be clearer and easier for you because you will know if a provider's charging within the cap or not. And I think I've covered most of those elements, and I'm sure that there will be questions.
I think one of them, Pat, let's talk about grandfathers, the grandfathering of provisions.
So this is what we talked about for existing participants. If you're in the system before the 12th of September last year, you're currently receiving a package or you'd been allocated a package, you won't pay any more for that. But this is where we were talking before. You won't pay any more. That's the grandfather position. You'll continue to get your package. You'll get a package.
How long?
It continues.
Okay.
Forever. Yeah, there's questions about that. We believe we've been told that won't change. We'll confirm that for you.
Another question. I'm currently receiving personal care and domestic through 2 different providers. Will I need to now just have one on the package, or can you continue to split?
So that's within a package? The question's within a package? I think that will be...
I'm not on a package as such.
No.
Now.
So remember that if you're currently on the Commonwealth Home Support Program, you're not affected by these changes at this stage.
So that's likely if you're receiving services from different service providers, that's probably Commonwealth Home Support.
There was another related, if you're currently on CHSP, will you transition to HCP or does it stay separate?
So as I said before, the Commonwealth Home Support Program continues until at least 2027. We would expect there'll be other government announcements about that as they get closer and what it looks like. So the no worse off principle on the grandfathering is for people who are in the home package program at the moment that will become support at home in a couple of weeks' time.
We'll do a couple more questions and I think we've all earned a bit of a break.
Definitely.
Just have a stretch.
So can we go to Mark in the room?
A couple of final questions from the floor.
Oh, thank you very much. Just with the changing of providers, we're a bit stuck. Mum's in transitional care. This is just the scenario, and I'm sure there's others. And everyone's stuck in transitional care because they can't go into residential care. We haven't let go of our package because obviously for reasons we all know.
Don't let it go.
Don't let it go. It's gold. So what's effectively happened, the benefits have increased quite considerably because she's been in hospital since January off and on and in transitional care for about, 4 months now. If we need to change the providers, which it seems we may have to because the current one cannot help Mum, if she comes home, that is, because if I don't know how long a piece of string is in transitional care, but the scenario I'm faced with is we're waiting on residential care, but because there's more funds, I'm thinking that there's more availability for Mum to have care 3 times a day as she would pretty much in transitional care because she sleeps pretty well. You know, that would mean I would be up worrying about her, things like that. But if we came to that, we would need to get another provider involved or change providers who can do the full servicing the whole day, including weekends. So I've been advised by our provider that they don't have any services in our area after 2 o'clock. So there's that switch. The other thing is if we do switch to another provider, we need to wait 70 days before the funds are transferred, which is legislated, I'm understanding, and unable to be changed. That 70 days, last time we changed, was 90 days. So when Mum...
Sorry, could we make this a question? It's just
I think I was just going to say maybe what we should do is have a chat in the break or after the session about your specific circumstances so that we can try and assist you.
I think the 70-day thing is is the real crux of my question. I was just
Okay.
giving you the.
So we'll have a look at that.
Couple of late ones before the break. Is 130K going to be indexed?
Yes, it will be.
Yep. And finally, is the application for hardship being simplified? I'm aware it's
Yes.
very long and complex.
It has, and I should have said that it is. Thank you. I think someone's given me a nice question there because I didn't cover it. It has been significantly simplified down to about 4 key pieces of information that you're going to need to provide. I'm looking at Kristen to make sure that's right. So it should be a much simpler process for people to do, and that's again something that OPAN and COTA have advocated for quite to make it easier for you. If you're already in a position where you're stressed out because you can't afford the services, you want to make this a seamless and easier process. So thank you for whoever posted that question. There's been quite some significant work done by Services Australia to try and streamline that.
Last one before we stretch.
With the with the grandfathering, while we're saying nothing changes if you're grandfathered on the money you receive, we know that it will change services. What happens then with our existing package, which has care fees and package management fees? Do we still pay those old fees, or are we in fact on SAH new fees?
You transfer into the support at home program, but you won't pay differently or more than you pay now, is how I understand it.
So basically, we're on the SAH program.
But you won't pay more for your fees than you're currently paying. You won't pay more than what you're currently paying, and as you said, you might be impacted by having less services.
So that then means that we're paying, like currently, 33% of your package, but then you're also then paying the new service fees, where the providers have actually made up the 30% on the new fees, because if you're on SAH, you're only paying 10% in package.
But the amount that you're paying stays the same. So for the services that you're receiving, so that's the best way I can explain it.
We don't transfer to the new services fees.
So the prices will come in. Sorry, I know this is confusing, and I'm trying to explain it the way that I can, and we'll try and make sure that in the questions and answers we give you a really clear explanation. My understanding is that you transfer across to a support at home level.
Yes.
The services that you're receiving, you should be able to continue pending the providers.
Yes,
you won't pay more than you're paying currently. So I'm not sure with your question about the 33%. What you're paying for is the services you receive, the services that you receive, but you won't pay more.
Can we, if those want to keep that going, can we offer people a 10-minute break? If anyone wants to keep this going, we'll keep Pat in the hot seat. But I just want to give people a 10-minute break. Otherwise, we won't get through all the info. Thanks, everyone. Residential care.
Can I just do one thing before we do? Because I think we were sort of talking at cross purposes before, so I just want to try and clarify. So in a home care package, if you're existing and you're transferring over, there's 2 key things to know. There is your package funds that you get from government, and there are prices that providers are going to apply. Your package transfers over. As it is, and as I said, there's some technical things the government will do behind the scenes, but it transfers over. You will then sit with the pricing, the new pricing, but you won't pay more. So the providers will work out what they can deliver to you based on their new pricing. But it's also important, and the bit that I missed saying before the break, is currently providers, and this is where we were talking about the 33%, currently providers charge different amounts for case management, but from 1 November, they can't charge more than 10% for case management across the board. So you won't pay more than 10% for case management, and you will have a discussion with them about their new pricing. So there are adjustments to be made. The conversation you'll have with your provider is, what does the budget now allow you to purchase, noting that 10% will be for case management. But you won't pay, the amount that you're paying now is the amount that you will pay from 1 November. I hope that's a little bit clearer. We'll try and make sure in the written materials that that's clear for people. You still, the no worse off principle is you won't pay more, but you will need to have a discussion with your provider about what their pricing is and the fact that they're only charging 10% for care management and what that means for you, for your package. So hopefully that's a little bit clearer. Now residential care.
Okay. Residential care. So I guess by its nature, it's the most intensive and highest level of care, and we see people are still accessing residential care. It is a pathway for people who need that level of support, particularly where they're needing clinical, high levels of sort of clinical care, have chronic conditions. There is, prior to the new Act coming into place, there is a new instrument called the ANAC. It's the way that they work out the amount of funding that each person is going to get for the services, the support services that they get in residential care. There are also a whole lot of recommendations around improvement of food and nutrition in residential aged care, and this has manifested itself in the new standards. So I think Pat mentioned there is a new food and nutrition standard for residential aged care. That applies. So we've got, there's a nice, lovely picture with the new standards, which has the person. We don't want to place people, but the person is at the centre, and it's about you. And all the standards are about you. And then there are a whole lot of other standards you can see around that, the wheel, some that apply. All of these apply to residential care. The new standards do also apply to support at home. However, there are things like the environment and nutrition which are not applicable to support it, because the environment at home, it's your own environment. The Aged Care Quality and Safety Commission is not going to come into your house and assess your environment, and food is not one of the things that they're looking at. So I think we're really pleased with the new strengthened standards, and we'll be looking to continued strengthening and monitoring by the Aged Care Quality and Safety Commission. So some of the standards will mean things that have come out, particularly around the person, is listening to the people who are actually receiving the services, and we'll talk a bit more about that in complaints. So things like consumer advisory bodies are really important in this space, and they're now mandated. So providers are expected to have structures where they listen to people who are in their services. So what's going to happen? What's changing in residential aged care? So for existing residents, not a lot will change. Same for grandfathered in home care packages, supported home space. There will be the no worse off principle. The $130,000 cap in terms of contributions will be across
which is indexed every year. So
Yep. So, and in those tiers of service that we talked about in support at home, clinical care, there's no contribution. So government will, in residential aged care, government will be paying for the clinical care in residential aged care. But residents will contribute to non-clinical service costs, such as personal care, through the non-clinical care contribution. So we'll see. We're going to monitor this space closely.
That's where their assessment means that they can do that. There still will be residents in the system that government's paying those costs for.
Yeah, that's it. And the basic daily care fee won't change. It's currently set at 85% of the age pension, and that will remain for people who are currently in residential aged care. So what's going to happen from the 1st of November. So there will now be a hotelling supplement. So what does that mean? So the hotelling, they're the things that are not the care costs. So the cost of laundry, the cost of running the service in general, they will be means tested. So in the same way, Services Australia will be sending letters to people around home care packages, support at home. There'll be means testing for people who are new to residential care. So
and who are assessed as being able to contribute.
Yeah, absolutely. So the old RAD, the refundable accommodation deposit, is going to be indexed annually and will change by CPI from the 1st of July each year. And this is a big change. The amount that you pay for a room may increase. So in the past, the cap was 500? And so a provider would have to get special permission to charge more than that for the room. It remains, but the cap has risen to 750,000. So a provider can charge you more than that for the room, but again, they will have to get permission to do that. So you do hear of much larger contributions in some places, but they've received permission to do that.
And they have to go through a process to prove that it's okay to charge that much money.
Yeah. So one thing that we're probably not as happy about that is with the new Act is the retention amount will be reintroduced, that's the retention of the deposit that you've paid.
If you've paid the refundable accommodation deposit, they will now be able to keep 2% of that for every 5 years. So under the current system, they earn income from from interest on your refundable accommodation deposit. The new piece will be that they can keep 2% for 5 years from your refundable accommodation deposit, and then the rest is refunded to you. This is something that we didn't support and argued against, but unfortunately that's not where it's landed.
Yeah, so I think that will remain. So we've got one more slide, and then we can have some questions if that's okay. So the daily accommodation payment will be indexed on the 20th of March and 20th of September each year.
And the daily accommodation payment is where you've elected not to pay a lump sum. So if you pay a refundable accommodation deposit, it's a lump sum that you pay. If you're paying a daily accommodation payment, it's kind of like paying rent, and yes, that will be indexed.
So I guess, this whole thing about buying the room or renting the room will remain, but you might choose to do a mixture of both as well. So that makes it a bit more complicated, but it's still a choice that you can have.
I should say that this is where getting advice, this is in some ways more complicated than support at home in terms of your income and your assets and what the impacts are, and getting advice about the best way to do this is probably good. And I know that, if there are issues, David and people like that through the OPAN network can also provide some assistance.
Yeah.
Over to you.
Sorry, just to clear up if there's any confusion. So as of the 1st of November, the refundable accommodation deposit, the RAD, the lump sum, that won't be indexed. So if you pay $500,000 in RAD, yes, there's a retention rate of 2% for 5 years, but that's not indexed. The indexation applies to the DAP.
Yes, that's right.
Yeah, thank you. All right. So the other thing that we're probably very happy about is you cannot be forced to pay the higher everyday living fee, which used to be the old additional fee. So what we found in the past is that people were having to sign up for additional services that they may not use, like Foxtel and the wine with dinner, the newspaper, etc. All those things. But it was becoming a condition of entry. So people would have to sign up for those additional fees to actually enter the home. So that is no longer the case. You cannot be forced to pay to sign up for those things up front. And so you've got about I think it's 30 days after you enter the home to make a decision about whether you take up some of those services, which can be, which you can, it's your right to, but higher everyday living fee is, or health, it's being called, yeah.
Yeah, so it's really important because, as we said, people being forced to pay it, you've now got time to go in and to make a decision about whether you want those services or not. Some people will choose them and some people won't. There's more detail around how that works, but you cannot, and it needs to be really clear, and there is some more material that will come out from government about these are the things that the providers have to provide you for the government funding they receive and the co-contribution that you make. And it's only over that they can offer services and charge a separate fee, and you can go in without deciding to do that, and you may or may not choose to elect to do that once you're in.
Yeah, look, and often we hear about it's the wine, the newspaper, the Foxtel, etc. But it does extend beyond that. That providers can offer those additional services, and again, sorry. Yes.
But as said, if it will be based on the assessment that's done about people's means as to whether or not they pay it or government pays it for them.
We're getting a number of really specific questions that are probably a little bit more detailed than I want to throw to you guys that we will log and respond to. But there is one before we move into rights.
Okay, and I guess and I've talked about the lifetime cap, so I think that's all there is on Resi Care. Yep.
On a monthly statement, we're charged for a 30-day a month basic care management fee. So on a 30-day package, every 30 days, $126 basic care management package, and then a package management fee of $214 on top of that, on a subsidy of about $1,500. It seems there'll be a change to that.
So that's the support at home again.
Oh,
so
right.
I think, so can we log that question?
Yeah, we'll
I feel
log
like
that.
we tried to answer that before, and that people won't pay more than 10% for care management. I think we've kind of covered that. I understand that people might still feel confused.
So that was my wrong.
We will actually we will write a response that hopefully will clarify that, but I don't think there's anything else we can say that we haven't said.
Yeah. Let's move on to rights.
Are there any other questions on Resi? No, they're too detailed.
They're all detailed. I just...
Thanks, Pam.
And I did take a specific question in the room about what happens if two people move in separately for a refundable accommodation deposit. The answer is that sort of probably Services Australia is best to answer that question for you, because it does come down to things like the means assessment, etc. So I don't know whether we want to answer that now or whether we let you have a chat with Kristen after, and we'll make sure that we cover that in the written responses. Sorry, I know
Kristen
people
wants to answer it or not?
I know people will need to leave.
She wants to go for it.
Wants to go for it?
Go!
Go, Kristen.
I feel like we're going to go 10 minutes over if everyone's okay with that. Cool.
People can leave if they need to.
Okay. So I think... Okay. Yeah.
Ladies and gentlemen, Services Australia.
Oh, down, Kristen.
Okay. So I believe the question was if you entered on the same day as your spouse or on separate day, if you would have to pay a refundable accommodation deposit twice each. Yeah. Okay. So basically residential care, it's income and it's asset tested. Okay. So it's a combined assessment if you're a member of a couple. So we pull all of your income and all your assets together, and then they get split in half, and that half gets put towards the means test to determine what fees you might have to pay. Also in that, your principal home, under the aged pension assessment, is an exempt asset. However, under the aged care means assessment, it is considered an asset unless there is a protected person. So the spouse is considered a protected person, a carer or a close relative, carer that's been there for 2 years, or a close relative that's been there for 5 years. And importantly, they must either be getting an income support payment from Centrelink or eligible to receive one to meet that protected person exemption, unless it's a spouse. So if you enter on the same day, will you have to pay a RAD? Well, if there is no protected person in your home and your home is above the capped value, which at the moment is about $210,000, then yes, you would both be liable for a RAD. The $210,000 is also the first asset threshold. So if your your net assets are above that threshold, then you are liable for a refundable accommodation deposit. If you go in on separate days and your assets are below $210,000, and below $210,000, then no, you will not be liable for a refundable accommodation deposit. Okay.
Thank you.
We'll make sure we get that captured in the written responses as well.
All right, move on. Sure. Only if you do it into the mic.
Now, with all these changes and these residential care package people going to get all this money, will there be more beds available? Because is it going to change their finances? We hear that they're closing down, they're running at a loss, and so there's no beds available in Western Australia. So what's your opinion?
So,
all of a sudden they're going to start building them so that in 5 years' time I can go in, there'll be a bed.
I think what I can give you an opinion on is that the intent of these changes and people paying more is to make the system more sustainable so providers can actually build beds. I mean, you know, the introduction of the retention, there's been a whole range of other payments that have got into to improve workers' wages, etc. So I think that's the government's intention by making these changes. We still, like you, do hear that providers are saying maybe that's not going to be the case, and I guess this is another thing that we're going to have to kind of monitor. But the government's intention, and I'm not from the government so I can't, but the intention is that these changes will make the system more sustainable and that providers should be able to build more beds. Now we need to make sure that that happens, and so as we watch the implementation, is that changing it?
Yeah.
We don't know.
Can
I can't. Yeah. Government may have other figures that they could give you. As I said, that's their intent. I can't tell you for sure that that's going to happen.
Yeah, but Pat, I know from some recent conversations I've been having over the last couple of days with some aged care providers here in WA, is that they're planning to expand their services. Yeah.
So I'm hopeful that it will work, but I can't give you a 100% ironclad guarantee.
That's why we've got COTA.
We'll keep advocating that.
Okay, are we going?
I'll just be a second. So, with regards to no beds supposedly available in aged care facilities, so for example, at Fiona Stanley, there's a number of people that are ready to be discharged, but there's nowhere for them to go to because they can't go home, they can't live with family, and they're pensioners or memory unit patients or residents. I have visited a facility, a very nice new one, that will not take concession, will not take memory unit, but they happen to have something like 60 empty beds sitting there, and that's a fact. So why is the federal government or the state government not revving it up? And I read all the media, and it infuriates me because I went and looked at one of those facilities, and that particular facility owned 2 other facilities, and they are actually making a concerted effort to put concession and memory unit into one facility, and the other 2 facilities, guess what? If you've got 1.2 million RAD,
you get in.
You get in.
Yeah, look,
and this is a real concern.
Absolutely.
Yet the media is not getting a gist of it because Roger Cook's media advisors are ex-journalists. They work in media. They've worked in the past, and they only get the spin that gets released out of the Cook's office.
So look, we're really concerned about that too, and one of the things that COTA and OPAN pushed for is, and it has started now, there is going to be a review around accommodation pricing and the way the accommodation works to make sure, because we want to make sure that sometimes people call them low means or concessional residents, that they're not, we don't create a 2-tier system. So that review to try and make sure that that's not happening is underway now, and we'll both be on shore making submissions and raising that issue. On the issue of hospitals and beds, we do think there are problems, and yes, there needs to be more home care packages, and yes, there needs to be more aged care beds, but state governments also have a role to play in terms of making sure that people can access hospital in the home and transition care. So we continue to advocate on that front as well. It is an issue and it's not good enough.
Okay, we'll go on to rights. So, look, under the previous system, the things that we heard from people is that they didn't feel heard. They complained about issues. They went to the Aged Care Quality and Safety Commission. issues weren't resolved, that communication was poor, and nothing happened. So, you know, and there was no consequence for providers who did the wrong thing, you know. And it's hard to make a complaint, you know. We know, and I was chatting to someone before saying it's really hard to make a complaint when you've got a loved one in a residential aged care home where you feel there'll be consequences. So, look, the evidence in the Royal Commission shows what happens when there are people who don't listen, what happens when you don't listen to complaints, and we shouldn't feel afraid to raise issues. So what's happening, what's changed in the new, with the new Act? So there's a statement of rights that Pat talked about. So go to the slide. Yep, sorry. So you can make a complaint and where your rights are not upheld. So you can actually complain about specific rights on the Statement of Rights. So, and the Aged Care Quality and Safety Committee is, they must be investigated. So that it's a great way. The quality standards have been strengthened and they're more measurable, detailed and comprehensive. So we can actually measure where there have been changes. The thing we're very excited about is an independent complaints commissioner, and Pat said has just been appointed. Look, there are now restorative pathways that can be taken, and providers can be fined when they haven't upheld your rights. So I think the maximum fine is about $1.5 million. We heard a lot about people wanting criminal sanctions against providers who had done the wrong thing. So if something had happened, somebody to be responsible. We didn't win that argument, but we have clear restorative pathways, fines for providers who are going to who've done the wrong thing. So I think the Aged Care Quality and Safety Commission, I guess what I'd say is their tool belt of punishments has been increased. So they can sanction, they can close down, they can fine, they can ban workers from working in aged care. And I think I looked at the list of banned workers the other day and it seems to be growing.
They're looking also governing persons. If they've done the wrong thing, there can be a banning order. So there are some strengthening that's happened as a result of the Act.
Yeah. Look, the other great thing that we're, in terms of monitoring and if this is going to be working, is that there's a 3-year review on the Act. So we'll see. We'll keep our eye on what's happening in terms of upholding your rights.
I should say that we argued really strongly and Parliament agreed that I think there was talk that it would be a 5-year review. It wasn't legislated. It's now been put into the legislation. It will happen at 3 years. So if there are things that are problematic, it will be addressed. Government will, of course, be monitoring this and will be continuing to advocate for you on things that are problematic. That's why it's really important that we continue to hear from you. So there will be other ways that we can raise these issues too.
Yeah, and importantly, there are now whistleblower provisions built into the Act. So that means you, yourself as a person receiving services or a carer, or even staff in services can raise complaints under those provisions.
Shall we run
Bring it
straight
home.
into let's go into supported decision making, which is really important. But there's some important numbers on the slides that you'll get for the Aged Care Quality and Safety Commission if you do need to make a complaint, and importantly for OPAN because they provide independent advocacy. So if you're not comfortable raising a complaint with a provider or talking to the Commission, they can help you with that and help you try and resolve those issues. So I'm going to talk quickly about supported decision making. It is really important and it's a really important feature of the new Act. As we indicated before, there's all sorts of views about what older people can and can't do and whether or not they can make decisions, and this new Act absolutely puts to rest that older people can and should be able to make their own decisions, and in fact they have a right to make their own decision. You have a right to access information in a way you can understand it. You have a right to be provided with accessible decisions, and you have a right to be supported to make decisions if you want to be. Same way that you would now. It's another talk for another time, but I'll have to talk to you about benevolent ageism some other time, where people assume that older people can't do these things. It's important to know that you have these rights even if other people don't agree with your decisions. and it includes taking a risk. Now, sometimes you'll hear service providers talk about that as the dignity of risk, and the Commission and providers can have conversations about that to make sure that you can take a risk. That's something that you can do. And you can still make decisions if you have a diagnosis of dementia, even if you find it harder to make decisions than before. There are ways of trying to make sure that we understand what the person with dementia wants. It might be in the early stages that, you know, there's times of day that it's easier to make a decision, but there's ways of making sure that people who have a diagnosis of dementia can still make some decisions and be supported to do that. Now, you'll all know about substituted decision makers who are appointed. You might hear about enduring powers of attorney or guardians. They can be appointed for some types of decisions, but you still actually retain rights even when that's the case. You've got the right to be involved in decisions that the substitute decision maker is appointed to make. You can make all other decisions on your own. It's only the things that they are appointed to make decisions with you on. Or you can have support if you want to, and you can still have access to information in the way that you can understand it and be provided with accessible services. So those substitute decision makers do continue, and they tend to be ones that are registered at state and territory level. What's changing in the Aged Care Act is there are no longer regular representatives or authorised representatives or nominees in aged care, which was the language before. What you can do now is register a supporter if you want to, and you can register your supporter with My Aged Care. You can choose to have a supporter for one decision, and that doesn't mean you need to have them for all of your decisions. And no one, whether it's your friends, your family, or an aged care provider, can pressure you or require you to register a supporter or have a substitute decision maker. So that's really important.
Yeah. Pat, I think right now the things that we hear from older people is that when they, particularly in residential care, that when they enter, they're asked, oh, you must have a power of attorney, you must have somebody who can speak on your behalf. You can't be forced to do that.
No, absolutely you can't. Okay, thank you for letting us know. I think there are. I'll need to check that for you. Let me get back to you on that. I don't know whether you want to make any comment about that. No, we'll check that for you and come back to you. There are 3 different types of supporters. There is supporter light, and that doesn't mean that they're free of sugar. A supporter light can support you in making decisions, and they can communicate your decisions if you ask them to, but they can only be registered as a supporter with your consent. And it means they don't automatically get information about your care. You choose what information you share with those supporter lights. Then there's just your standard regular supporter. If we can bring up the next slide, please. They can support you in making decisions the same as the other can. They can communicate your decisions if you ask them to. They can only be registered with your consent, but they will automatically get the same information about your aged care that you get. So that's the key difference. A supporter light doesn't. You can decide you don't necessarily want them to have the same information, but if you register as a supporter, then they're going to get the same information as you. And for some things that you might want that. And then finally, the one that we're probably all familiar with now is the supporter guardian, and that's someone who's also an active substitute decision maker in the way that you would understand that now under state or territory legislation. Largely it's the same, that the way that it works. The big differences are they can be registered as a supporter without your consent, but only while their substitute decision making powers are active under state or territory law. They can only make decisions for you that are outlined in their state or territory appointment document, and they can't make any other decisions for you. Let me bring up the next slide just before we... Is that the last slide? Okay, terrific. Okay. So it's really important. Supported decision making is incredibly important to make sure that older people are given the right to make their own decisions.
Can I comment on supporters or nominees or helpers, whatever? The system, and unfortunately our intelligent government doesn't transfer that role to the other systems, such as Centrelink, My Aged Care, My Health. So if you're a supporter in My Aged Care, don't assume you'll be a supporter in the other systems, and to register for any of those systems can take up to 2-hour wait on the phone to get through.
Thanks, Margaret.
That's great feedback. One other bit of feedback, thank you for the rights legislation. This one will work. Most important matter in the legislation.
Absolutely.
Any other questions before we wrap it up? Okay, you're faster than me.
I've already asked Services Australia rep this question, but with the two streams at the assessment, either residential aged care or home support, is there going to be anybody there that can support with supported decision making to make sure that the older person's rights are upheld?
Well, I think the rights will do that. So I think that it's built into the system now around the rights that you have, and if you've appointed someone to support you, then that should be respected in that way too.
Do you mean at the assessment visit?
At the assessment face-to-face visit, when often there is conflict with somebody really perhaps needing to go into aged care and the older person not really wanting to go.
Yeah, look, I think that's a different sort of question.
Question.
And I think, it's the assessor should be skilled enough to navigate that conversation with the people who are involved in that discussion. Look,
What I'm asking you,
they're upholding the rights, but I think they're navigating that conversation. It's not easy. No.
it's not easy, but what I'm asking is, if you know it's going to be difficult, is there some provision of having an advocate present or the option or something?
You can have someone present with you if you're having an assessment.
But you can't be forced to have an advocate present.
You can't be forced to, but will there be the opportunity to have one if you require one?
Yes, I think you can ask.
And that's what I think we should be asking Services Australia. What training people
more clarity on.
So my understanding is, if you want, you can have people with you who you want to have with you at an assessment.
One more question that's just come in. If you are a guardian of someone already in aged care, do you need to register? If you are a guardian of somebody already in aged care, do you need to register?
I think that's happening automatically.
Without any other questions, can we just pull out our phone one last time? I'm really interested in knowing, before we finish up, how are you feeling now?
The horse race again.
In terms of how informed you feel. Again, so if you still reckon you know nothing, you're a 1. If you reckon it's time for you guys to go up on stage, it's a 5. And if you hate it, down here, if you think this is a step in the right direction, up on the strongly agree. We've got 1, 2. Oh, they were moving quickly. We've got some experts in the room now too, which is outstanding. We'll give that for a couple of... We'll let that run for...
Can I just say, it's really appreciate that people have been able to contribute from their own experience and from their own knowledge. That's been terrific to have all of you in the room to do that.
And it really is the wisdom of the masses. These town halls have let us get so many really interesting perspectives on the changes, Pat. The other thing we are going to do once the horse race is over is just have a little open-ended. We'd love you if you spend just a minute or two letting us know your reflections on this discussion, anything you'd like us to know, anything you particularly want us to tell the government. That would be really good to know too, although I think we've picked up a few of those themes through the Q&A.
And absolutely remember that OPAN, Advocare, COTA Australia and COTA WA are here. We do talk regularly to government, to ministers. If there are issues, please reach out to us, send us emails, ring us up and let us know what's happening for you so we can continue to keep up the advocacy.
And just there is a profanity filter.
But I think if people are happy to keep doing that, maybe we can ask our colleague Mark to come up and
that'd be great.
close
you can
the
have
session.
the wall of
I know
feels as you do it.
I know we're running late.
Hi everyone, how you going? My name's Mark Kinseller, so I'm the CEO of COTA WA. So we're a subsidiary of COTA Australia. 2 seconds for your time. So we're your voice, and we're a free membership organisation. So please sign up. Just go to our website and become a member of COTA, and we can help represent you in Western Australia. I'd really like to thank my colleague up the back, Kyrie, who's here and been helping keep you fed, and Wendis, who's already headed off. But a couple of things. Kyrie actually runs our Strength for Life program. So one of the really important things as we age is we make sure we stay physically active. which both helps us with our mood and our brain and our mind, but also with our bodies. And so we run a program called Strength for Life. We've got 47 providers across Western Australia, and it's about staying physically fit and active. You don't necessarily have to do Strength for Life. It's a great program, but do something that keeps you physically fit and active. There's another thing I just wanted to draw your attention to. So Shawnee mentioned that Advocare is the peak body here. We're actually running a process at the moment to develop a reference group for the peak body. That's a group of older people who've got experience being in Western Australia to provide feedback to the peak body. So there's a couple of forms just outside. Please, if you'd be interested in representing the people of Western Australia, your interests, your rights on issues that are affecting older people in Western Australia, please take a form, fill one out, either give it to me when you're leaving or you can email it to us as well. But do please consider representing your state and supporting the issues that are affecting older people. And finally, just closing, I know, there's been some great conversations here, really good conversations. I think one of the things I always believe is that unless you have the information, you're not able to make good, well-informed decisions for you and your loved ones. And so you have all taken the fantastic step today to come and get information about aged care. We're only able to do this because of the Department of Health. Now, there's only one of these at the moment. I would love us to be able to do these every week, all throughout the year, so you can get information. So if you get a chance to advocate for these sorts of things, I'd really like to thank my colleagues from COTA Australia and from OPAN for being able to come here and take the onslaught of questions. It is all new and it is all quite daunting, and there are big changes, but I'd also like to really thank you for taking the effort, taking the initiative, for going and learning about the aged care system and hopefully helping us advocate for you to make sure that we get government to make this system work for older people. So thank you.
Thanks, everyone.